There have been many treatments and management strategies that have been proposed and been trialed for long COVID in the UK and throughout the world. For this video, I'll be focusing predominantly for the UK population. There are some suggestions and protocols that are being looked at for long COVID treatment in the US that are coming from South Africa and from other international collaborations. But I'm the lead for a long COVID service in the UK, and I'm going to predominantly stick by what we are able to offer right now within most long COVID clinics and generally what is accepted within mainstream practice in the United Kingdom. Now, a lot of the treatments that I talk about in my service are very much tailored to what the mindset framework which I adopt for looking after pain patients or for patients with other long-term conditions, which I think what long COVID is going to be. So what is the mindset framework? Now, within the mindset framework, the M stands for medications. The I stands for any interventions or injections or infusions as appropriate. The N stands for the neuroscience and stress management strategies that might be. The D stands for any dietary or microbiome related interventions there. S stands for sleep optimization. E stands for physical activity and exercise in a paced manner. And finally, T stands for any therapies of mind and body that can be used to soothe the hyperactivated immune and nervous systems or both. So first, coming to medications there. Now, medications have been suggested and trialed for a lot of the symptoms. Right now, we don't have one drug that can help with all the symptoms of long COVID. As I'd mentioned in other videos, more than 200 symptoms have been reported from over 10 organ systems. So it's very unlikely that we'll have one drug that can cover all those organ system symptoms. That's not going to be the case. So what has happened is actually we've been able to use for symptom management. So for example, if people are having palpitations or heart rate problems as a part of their chest pain and cardiac symptoms, then we've been looking at beta blockers and medications like ivabradine for managing the heart rate control. If you're having breathlessness as a very common symptom, there's been a suggestion of looking at oral medication or inhalers to help with breathlessness management there, depending on breathing techniques or breathing exercise measurements. If you're having pain, then there is an option for looking at nerve pain medication or even simple analgesics like the paracetamol and the weaker opioids like codeine or non-steroidal medication there. Fatigue is something that really doesn't have any obvious treatments now, but certainly there is a role for looking at a variety of supplements and vitamins that can be taken in the form of pills. And there's research studies like Phyto-V, which are showing that there can be a combination of poly pills, one pill that contains a few supplements that could be used. So these are all some medication options. Obviously, there's been a lot of work looking at blood thinners because people might be having some blood clots. There are some treatments that are looking at whether we should be giving antihistamines when the histamine excess is there. But these are still evolving and we need more evidence, and it must be decided on case-by-case basis and patient-by-patient basis on whether some of these other treatments can be trialed or not based on their safety profile. So that is around the medications. Interventions, there may be some cases where if your immune system has become so active that you've had a new diagnosis of rheumatoid arthritis or some autoimmune condition, then certainly immune therapy infusions could be useful. There is a possibility that in some cases the arthritis might be so inflamed that they may benefit from a steroid injection, so that's a possible intervention that's possible. There is some research going on to say that treatments around virtual reality based interventions, distraction based interventions, education based interventions through using virtual reality or digital mediums can all be looked at, and that would be a possible way forward. The third part is the N, which is the neuroscience and stress management. Now, since we know that the nervous system and the immune system is most impacted and that the circulatory system can also be impacted, then there is certainly the big role in trying to see whether managing stress, understanding the reasons for long COVID, and understanding what you can do to calm the nervous system down, could they be useful ways forward. And stress management strategy, breathing techniques to calm down stress, feedback techniques to calm down stress. There is a possibility of using something called heart rate variability, which is a way of reducing stress once you know what your heart rate is changing, and that all can be looked at as a way of calming down the nervous system and using these stress management strategies to reduce the symptoms of long COVID. In my next video there, I will look into further techniques of reducing or calming the nervous system down using the mindset framework. Hi, I hope you enjoyed that video. If you want to hear and see more, then please click the subscribe button and hit the notifications button so that you'll know when the next video is released.